Hello, my name is Jocelyn. I am here to introduce a topic, and my targeted audience is going to be for elderly people. I first off want to start off what my project is about. So, the topic I chose was about heart disease and stroke. One of my measurable goals is for participants to maintain their blood pressure between 110 to 165 to 130 to over 80 for 2 months by monitoring their daily blood pressure with a blood pressure monitor. First off, I want to go over my objectives. I chose 3. My first one is for participants. Participants will engage in exercise for at least 30 minutes for 5 days per week. Participants will reduce stress levels by practicing stress management techniques at least 15 minutes daily. And then my last one is participants will limit sodium intake to less than 2,300 milligrams a day. I'm also going to speak about what heart disease and stroke are. Sorry. Heart disease is a term used to refer several types of heart conditions such as heart failure, arrhythmias, which are abnormal heart rhythms, and also another one that I put on here was like heart attacks. Strokes are a medical emergency. If you ever feel that you're having any sort of symptoms that I'm going to be mentioning, make sure you go to the hospital right away. Strokes occur when something blocks like the blood supply to your brain, either being a blood clot or when you have a hemorrhage meaning like bursting of an artery. If it ends up being a clot that's obstructed in the blood where the blood supply is, that would be a ischemic stroke. Or if the artery bursts, that would be considered a hemorrhagic stroke. Some of the statistical data that I did choose is up here. I want to start off by American Heart Association. Based on 2023, the age-adjusted U.S. death attributable to cardiovascular disease is 218 per 100,000. Also, based on 2021, the age-adjusted global death rate attributable to cardiovascular disease is 235 per 100,000. For the National Library of Medicine, in 2021, there was 93.8 million prevalent strokes globally. And then CDC, every 40 seconds, someone in the United States has a stroke. Every 3 minutes and 14 seconds, someone dies of a stroke in the country. Every year, more than 795,000 in the United States have a stroke. In the United States, in 2023, 1 in 6 deaths from cardiovascular disease was due to strokes. Some of the risk factors that I did include, starting off for heart disease, would be smoking, high cholesterol, physical inactivity. Some symptoms for heart disease. This would be more of a broader thing because this can happen for like chest pain, which would be a heart attack, but it can also happen for many other heart conditions. Another symptom would be shortness of breath for like heart failure as well. Palpitation, dizziness. Some risk factors for stroke: smoking, high blood pressure, diabetes, and physical inactivity. So for risk factors of heart disease and stroke, they kind of have similar things just because they work kind of similar, I want to say. Symptoms of stroke: slurred speech, facial droop, extremity weakness, headache, eye vision changes. So here I included the BFAST method that has to do with stroke. We use this acronym to, if you have any of these symptoms, just come to the hospital. So the first one is balance, sudden balance loss. Like if you're struggling to keep your balance, that's a symptom. Eyes, which would be sudden vision changes or blurred vision. Face, if you're having like a facial droop on either side, or if you feel like you have weakness on your facial as well. arms, if you're having weakness on one of your extremities, your arms. It could either be like numbness, tingling, or just weakness. Speech, if you're having slurred speech or trouble speaking, and that can also be considered a symptom of stroke. And then if you have a headache, that's also a big thing to look out for. Some of the precautions that I mentioned, which are going to be down here: smoking cessation, which is such a big thing because that's a high risk factor as well. Managing your blood pressure. It's important to manage your blood pressure because if, let's say, you do have a really high blood pressure, you're at risk for a stroke. Regular checkups, alcohol cessation, which are also huge. I also did mention, I included a few pictures. So I first off want to talk about this one, which is a heart healthy diet. What is recommended, which is lean proteins such as chicken, turkey, tofu, some fruits, vegetables, olive oil, nuts. Things to avoid would be simple refined carbohydrates like white bread, white rice, cereal, processed foods, red meats. And then here I included best exercises for heart disease prevention, which would be like weightlifting, walking, yoga, which also would include with the stress to help with your stress management. Body weight exercises, swimming, cycling, walking. This concludes my presentation. But if you ever have any of these symptoms, just go ahead and go to the hospital. Thank you.